Historically, African Americans really never addressed mental illness in our community. It was a taboo subject, and it caused much pain and much continued health deterioration, in my opinion, that has resulted in many other social issues in our community.
Approximately 12 years ago, the African American Mental Health Commission came together to assess and determine what would it be that would allow African Americans in the Portland metropolitan area to feel comfortable seeking mental health treatment services. They did a needs assessment, and with that assessment, they determined that people would feel more comfortable if they had services from people who looked like them or looked like us. And so the idea for the OHSU Avel Gordly Center for Healing was born.
I felt like at that time I was a bag lady. I was going through life, I was carrying all this baggage, all the past hurts, all the past disappointments, and I felt like I wasn't able to go forward because of those things. And so I decided let's put these bags down.
The counseling process itself is just a process of sitting and talking in a confidential environment with somebody who believes in you, who wants you to feel better, and can serve as a sounding board, a coach, and a guide.
What I tell everybody is that everybody has mental health. You know, there's bad mental health and there's good mental health. And I talk about that to normalize what mental health is about, you know, and to validate some of the fears. You know, I'm feeling this, I'm fearful of that, and then we begin to explore those fears so that when you explore the fears, you find out that your strength is when you face those fears.
My therapist was welcoming. She just let me express myself and told me it was okay. It was somebody saying, it's okay to cry, it's okay to be sad, you have a reason to be sad. And so it made it a smooth transition to actually be able to express those things that were going on.
We also realized that we had the opportunity to work at taking away the shame associated with mental health, mental illness. And that's very important work for me because I live with depression myself, clinical depression that goes back to when I was a child.
If you were to fall and break your leg, there wouldn't be any stigma associated with going to the emergency department and getting a cast. But if you fall and break your heart, then somehow we're expected to just pick ourselves up and go on.
What is truly wonderful about the Gordly Center for Healing is the staff. We have a multicultural staff of professionals who they're here to serve.
Coming to the center, my life hasn't been the same. I am a happier person. I'm in control of what goes on with me.
It is my hope that the Gordly Center can become a model for other centers to provide culturally specific trainings, therapies, and resources to other communities.
It's about healing, being healed, and living a full life.
Hello, I am Will Hardy, the chair of the African American Mental Health Commission. I'm also the pastor of Highland United Church of Christ. I have seen firsthand what happens when a citizen, a community member, is having a mental episode. I have seen the traditional services being provided, and I was very unhappy, unsatisfied with the disconnect between services and the culture and population it had to serve. Here is where the Oregon Health and Science University Avel Gordly Center for Healing stepped in and closed that gap. The quality service helps to reduce the stigma, remove the shame, and provide culturally competent and responsive services to a population long time underserved. Yes, I want you to be proud of what's happening right here in the state of Oregon, because this clinic is definitely a feather in Oregon's cap.